do you guys feel sometimes that we get some patients that, sometimes they're a little bit rude,
Yes.
or they're a little bit like more rowdy,
More aggressive.
but do you guys feel that it's what is it like being a female dentist? You don't know what they're thinking inside their head, because we have some patients out there, guys, that say, okay, just do what you have to do. I'll let you pick. And then they come in and they say, that's not what I was looking for. So how important is it for a patient that is looking for aesthetics? That aesthetic is the number one purpose. How important is it for them to
Keep learning and start with the implants too.
Yeah, that's true.
Yes, I remember.
So that's good. Well, there it is. So in the near future, in the very near future, I am going to get my smile done.
And when do your lips, you cannot do nothing. 3 days. No kiss, no like...
You can't kiss for 3 days?
No,
Oh, you can't squish nothing?
nothing.
What about when you drink?
With us.
Like
You
a straw?
can find the way to drink.
So what's next? What's next for the ladies in Supreme? What do you guys? What's the vision? What do you guys want to continue on pushing?
I'm continue pushing on the cosmetic and eternal beauty. I like to go to more trainings to
Okay.
get.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Apple Podcasts and we're on Spotify. And today we have two very special guests. We have Dr. Michelle.
Hi.
We have Dr. Dulce.
Hi everyone.
Just to let you guys know, these girls love to be in the podcast. They were asking me and begging me to be in the podcast. So I want to talk. Obviously, you guys are our female dentists that we have, our lady dentists. And a lot of times when a patient pictures something very aesthetic or very pain-free, it pictures getting it done by a woman. Okay? So I want to talk about different subjects. So, for example, cosmetic-wise, okay? So when a patient wants veneers, when a patient wants a full mouth of Emax crowns or just zirconia crowns, we get different types of cases. We have the case that someone comes in and their teeth are completely devastated, destroyed. Please help me. They hurt, and I want them to look nicer. And then we get the patient that says they feel fine, but I want an aesthetic look. I want to know how important, and both of you guys have seen it because you've been there when we have different things going on.
Mm-hmm.
So how important is it for a patient that is looking for aesthetics? That aesthetic is the number one purpose. How important is it for them to perhaps look at different smiles before they come in?
Yes.
Look at different pictures. Perhaps the teeth that look good on this person won't look good on me because we have different stuff. But at least you guys get a picture of what they're looking for. What do you guys think about that? What can we suggest for our patients out there?
Yeah. Well, we check the bite of the patient, the shape of the arch, and if the teeth are a little bit sheaf or something.
Okay.
But when they show the picture, I can have an idea what they like to do.
What they're looking for.
Yes.
I think the other thing is the shape of their lip, because
Okay.
many times we have patients that they don't have lips, and they show a picture with I don't know, an artist or a model that have really juicy lips or very straight or different.
She said very juicy lips.
Yes.
Okay.
And when they smile, the line of smile, it looks straight. But some people have the lips.
Like me.
Yeah.
Yes.
Like when I smile. This, okay.
It's not in the regular position. And when Dr. Dulce put veneers or crowns and they smile, they think they are wrong or they are in a wrong position. And it's difficult because it's your bone and it's the shape of your lip.
Okay.
You need to take that advice to when you see a picture of another person.
So it's like when you go to the store and you want to buy a dress. But the dress, the girl that has it on is like a Victoria's Secret model.
Yes.
And the girl that wants to purchase it is not. So the dress is going to look a little bit different.
Yes.
Right? So we got to keep that in mind. So then you're telling me that a patient should look at some pictures, bring a picture with them, so then you can understand kind of what they're looking for.
Yes.
So you're telling me you're not psychic. You don't know what they're thinking inside their head. Because we have some patients out there, guys, that say, okay, just do what you have to do. I'll let you pick. And then they come in and they say, that's not what I was looking for. How am I supposed to know that? How are you supposed to know that?
Yeah.
And then you tell them, well, what are you looking for? Well, I was looking at them a little bit more like this. Well, why didn't you tell me when I asked you in the beginning? Now we let 1 day or perhaps 2 days pass by. Now you're in a rush because now you're trying to catch a flight.
Yes.
But it's not our problem. You know, it's if I want a car, I don't go to the dealership and say, show me what you got. I kind of have a mentality of what kind of car I'm looking for, perhaps a color that at least I don't want. And I want a 4-door because I have a big family. Well, it's 4 of us. And so if they show me a Corvette, it's going to be nice, but I don't care about it. You know, so it's like don't waste my time and don't
your
waste
time.
your time.
Yeah.
Because at the end, we're just wasting time and we're back to square one. And now the bond kind of broke in a way, you know, because now you understand and now you'll get it right in their eyes, but it would have been a lot easier. Communication. I think there
Yes,
should be
it's
a lot
very
more
important.
communication. So when we're talking about that, you brought up a very important thing. You said sometimes the patients bring pictures and they have somebody has bigger lips. So teeth look different on bigger lips.
Yes.
And the patient has like no lips.
Yes.
So now that we have Eternal Beauty here, and you are who's representing us at Eternal Beauty, you've been to what places have you been to?
Brazil.
Brazil?
To get my training.
And you were also in Tijuana, right?
Yes, Tijuana too.
And okay, and then you went to what did you go do in Guadalajara?
Another
one?
training.
Okay. I lose count because you guys are everywhere. So you went there for a reason, and you know how to make this smile look perhaps even better,
Yes.
depending if the patient needs different work here and there. So aesthetically, you are taking care of the teeth portion, and you guys can work together. Actually, I've been there when you're like, wait to get lips to after you get the teeth, or the other way around. I don't remember.
Yes.
So you guys work together to make the final product look.
Yes.
So tell me a little bit how important it is. I've seen patients that already come with lips like this, and they're like, I want more lips. You know, and you know who I'm talking about. But and I'm like, no, they're going to pop. I don't even know if they
No,
can
we
pop, you know.
can't.
But how important is this like a psychological thing, or how important is it?
Well, in my area, in my opinion, I think the people that have like very thin lips, they want like the juicy, but it's not gonna happen in one appointment.
Okay.
We need 2 or 3 appointments, but this appointment it's going to be like in 2 weeks later. But we have the patients that they don't have time to stay.
They want it now.
They want it now, and I can't because the tissues, they don't. I can get that because if I do it, maybe the product is going to go to another place. That's the danger of putting more product. And the people that already have a lot, we cannot put more because it's not enough space.
Okay. So when you say juicy lips, you're talking about the volume.
Yes.
Of the luscious. It's
The
called
love it.
luscious lips.
Yes.
Thick. Thick. Yeah, because you say juicy. I'm like, do
Juicy.
they leak? So it's just like,
No, but
Okay, look,
they,
yes,
the patients tell me, I want a juicy lips.
oh, so that's a thing.
They
Oh, cool. I
want,
didn't know that.
and they don't have nothing, and I'm telling, well, this appointment is not going to get done like that. We
Okay.
can start, But
process.
you need the process, but you need 2 or 3 appointments.
Okay.
And see how it's going, the results.
Well, then they could start here, and if they can't finish it, they can go
Yes.
somewhere else. Okay.
You can do that.
Okay. Okay. Did you learn something? you want juicy lips?
And we recommend, and Dr. Dulce and I, that first dental work,
Okay.
because they manipulate touch. They need to keep open a lot. They need to
To know.
Get in there and
and all that thing. And when do your lips, you cannot do nothing. 3 days. No kiss, no
You can't kiss for 3 days?
no,
Oh, you can't squish nothing?
nothing.
What about when you drink?
With us.
Like a
You
straw?
can you
Yeah.
can find you can find the way to drink, but because it's going to be very sore and with a lot of inflammation. But in the 4 days, it's going to getting down. But the first 3 days, it's the most like bumpy,
Really?
complicated. Yes,
Okay.
that's we recommend to the patients. First, dental work, veneers, crowns, and the end, you can do your lips or the other cosmetic things in your face.
Going to and plus you're the root canal specialist.
Yes.
And that's why I thought before anything was started with that, my wife and I talked to you, I thought it was a perfect transition, and I'll tell you why. Because you being a root canal specialist, you know a lot about the nerves in your face, in your mouth, and you were really good with giving shots, numbing.
Yes.
Actually, there's been some situations where one of our specialists cannot make the patient go numb, and you go in there and you go ahead and make them numb.
Help. Yes, I help to my
Your colleagues.
doctors.
So with that being said, that you're really good at giving shots, and a lot of patients say you're really soft with your hands. So that transition perfectly to the face,
Eternal beauty.
the eternal beauty. Yeah, that
Yes.
was awesome. So, talk to me about the masseters. So
Okay.
talking about now all on 4s and all on 6s, you come in, you get a brand new smile, your final product. You also done second stages for the all on 4. I can no longer feel because now my roots are made out of titanium. So what does that mean? That means I bite harder, I'm more tense sometimes. And doing that shot in the masseters of Botox, what does it do exactly?
Botox is the brand that we put is a toxin that it's to relax our muscles. When you do a full mouth restoration in all on 4, they are modifying your old bite to a new bite, and your muscles they are not used to the new bite. That's why we need to relax and help your muscles to use to the new bite that you have right now, and help it with a little toxin. That toxin puts here in the masseters and helps to relax. You're gonna bite normally. You're not gonna look different because the patients told me, no, Botox, oh no, I'm gonna look different. I don't want to, nothing in my face. And I say, it's not. It's like, it's
inside.
it's inside, and it's for medical purpose, not for cosmetic.
Yeah.
We put it here. It's only 4 points, and the muscles they're going to relax, and then the patient when they come back, they tell us like, "Wow, I feel different."
Big difference.
Yes.
Even if you grind, they can use the Botox too.
Okay.
Or when you get a new smile, new veneers, full mouth.
So it's very important what you were telling me about veneers or even full mouth restorations where we changed perhaps the dimension,
Yeah, the length of the bite.
the length of the bite. And what this masseter does is it relaxes the bite. You can still bite, but it relaxes it
Yeah.
so you don't
Clinch a lot.
clinch. Okay. Okay.
It's like a reset of your bite.
Yes.
Ernesto got it done.
Yeah.
And he loves it. He says that he would wake up sore in the morning,
Yes.
and now he doesn't. But he still eats a lot. I don't know how that works.
When the people grind, it's because they have an stress. We don't know
Stress?
what. Yes, stress.
What's that? You know what that is? What's a stress?
They many patients that I have, I tell them, what is your main concern? When they tell me, I don't know, I only do it. I don't know. Just get like I'm sleeping and then I wake up and oh my God. And then
You're sore.
yes. And I'm telling don't stress, but it's not
impossible.
possible. That's why we need to help and put a little bit of botox or toxin that it's called.
So I got a question for both you ladies. So both you ladies are, like I said one more time, are dentists here in Supreme Dental. Both of you ladies have been in different parts of the world, Brazil, Prague, Czech Republic, and other places. And you guys are both kind of short. Okay? So it's not like you're really tall, but you're kind of short.
Yes.
So that
We
being
are petite.
petite. So with that being said, do you guys feel sometimes that we get some patients that, you know, sometimes they're a little bit rude
Yes,
or they're a little bit like more rowdy?
more aggressive.
But do you guys feel that it's what is it like being a female dentist for everybody who's out there, you know, because just because you guys are petite doesn't mean you guys are now like, hey, what's up? What's going on? You know? But doesn't mean like you guys are like,
We are worse.
yeah. So what is it like? Like, I mean, what is it like being a female dentist here at Supreme Dental in Mexico?
You first, Dulce. Your opinion.
I think it's more part of the person. It's not everybody.
Okay.
Yeah.
I think different. No. Oh, no. When I'm gonna, not here in Supreme, but when I came here in this town, I start like, I don't know how to say, like, hi, I'm Dr. Michelle.
Knocking in doors?
Knocking in doors.
Yeah.
Give my
Business card?
My business card, and they look me like, you are a specialist? Yes.
Wow.
And I was, why? And I asked a friend, and it's because you are a lady.
Wow.
And I was like, I don't like it too much, but I still fight. And they, here in Supreme, they give me the opportunity, and I have to 3 years here. And yes, it depends the patient. Most patients are very, very cute and very sweet, but we have patients that they see us like little, and they think they can say anything, or it's not, how can I say?
Like you don't have experience because we look so young.
Yes. We look young and short and like, and they think that we don't know the information, or we don't know to have to do our work. But then when we start explaining and we do the treatment, I think they change your mind, because I feel different, the patient.
You guys have gotten, and we'll put some pictures up here, you guys have gotten flowers and many gifts from patients that really, really were extremely happy with both of you on the work itself. And for example, my wife looks younger than me, and she's also a lot more petite than me. I could say that. And she's tough. She's a tough cookie. Actually, they know that when she walks in and she's gonna talk to somebody in the office by himself, I'm like, it was nice knowing you. Like you know, and you guys, if anything, I believe that women are the toughest in my office. Like, you guys are tough. The assistants, automatically, Gabby, Alondra, you know, even Cynthia, they're tough. If you talk about Miguelito, exactly. You know
the
what I'm
name
saying?
Miguelito.
So it's like, it's everybody. It's you know, you guys are tough. So so don't be confused. Don't let it go with, oh, you know, she's gonna be nice and she's gonna take my BS. Like, we understand some patients are frustrated, but it's very important to have a game plan before you come in. Hey. And then on your situation, we know that nobody likes to get a root canal.
Nobody.
Unless you're in severe pain and you're like, please make it stop. But besides that, nobody wakes up and says, I'm getting a root canal today.
No.
So when I spoke to you, I don't know if you remember, before we started Eternal Beauty, I said, this is your chance. And I tell you, this is why.
Yes, I remember that.
You patients come in and they're like, oh, I need to get a root canal. And they look at you like, like they're not like, they're not happy. When they look at you and you're going to change their smile, they're happy because aesthetically, but you aesthetically were not going to do any change to them. You were just going to
Relieve the pain.
relieve the pain, but medically you're going to help them, but not aesthetically. You weren't going to. So now with Eternal Beauty, you can make an impact aesthetically and medically. So that's awesome. But yeah, don't let the looks fool you guys. These ladies are tough, and obviously respect is one of the things that we want from all of our patients, because that's what all of our staff respects our patients also. So what's next, ladies? What do you guys think? So right now we're almost in the middle of the year. So what's next? What's next for the ladies in Supreme? What do you guys? What's the vision? What do you guys want to continue on pushing?
I'm continue pushing on the cosmetic and Eternal Beauty. I like to go to more trainings to get new techniques or new products that we can put here to our patients. Root canals. I like root canals, and I love doing root canals. But the patients, they don't like root canals.
Don't like root canals.
But I'm happy because when they go out here from Supreme, that root canal thing, they change their mind that it's not like they used to be.
Yeah, because they hate it, because they say, I got a root canal in third grade, or when I was younger, or I seen a documentary on Netflix when it was still there.
Yeah.
So everything's against root canals, and you do change their mind, because they're like, I got if there's so many reviews, I got 3-4 root canals, and I didn't feel a thing. I fell asleep, or whatever. So that's awesome.
Yes, because we use good steps, protocols, the best material, and we do a protocol. We enter to the tooth, we do all, and that's it. It's practical. Root canal, they don't have to be painful. If you are in pain and I can't do the root canal, you need to take medication and wait at least 1 day. But if it's not, we can do the root canal, any problem.
Okay. What about you? What's next?
More diplomators.
More
Yeah.
more
keep,
training, more
keep,
certificates.
keep learning and start with the implants too.
Yeah, that's true.
Yes, I remember.
So that's good. Well, there it is. So in the very near future, I am going to get my smile done.
Oh, yes. And another.
And I'm also going to get a procedure in my face. I'm getting a new nose. I'm just kidding. But I'm going to do some things because I'm 38 years old, so I need to be looking good for the cameras, like George does not get work done, and he needs it too. So yeah, I'll be getting work from these ladies. So all my work that I get, all the work that my wife gets, all the work that my in-laws get, everything is done here in-house. At some point, I was thinking about getting veneers, and we're talking about many years ago, and we didn't start offering veneers until not too long ago. And I told my wife, we're really good at so many things, and we know our strengths, we know what we're really strong at, but veneers in algodones was, nobody wanted to do veneers.
No.
So the training that from the dentist that would come knocking at our door would not be veneers. Be aesthetics, but not veneers. And I would look at other dentists, and I'm like, oh my gosh, like in Dubai. And I looked at one in particular, and I'm like, I want to get my mouth done. And then I was like, but how am I going to do that? Like, how am I going to be at my clinic? It's like getting my car done at another body shop. It doesn't make sense.
Yes.
So better yet, my team kept on moving forward. I pushed Tusi to Prague so she can go ahead and take that training. And now you're doing the aesthetic stuff at Eternal Beauty also.
Yes.
And everything, if I feel comfortable getting my work done here, and Josh Snow feels comfortable getting his fiance getting work done here also, the CEO of Snow Products that we offer from here at Supreme Dental, why don't you? You know, it's pretty. Your mom just had work here done
Yeah.
a couple weeks ago.
My
Your
auntie.
dad
My dad
got a new smile here too.
I'm gonna send you the picture of my dad to put here.
Dr. Elias's mom got a brand new smile. Dr. Luis, my dad,
Mother-in-law.
Your dad.
my mother-in-law, my dad got a brand. My dad got some work done in his face, but you can't really tell. He needs a lot. But he has a brand new smile. And I mean, if we bring our loved ones here, that means that we're gonna treat you the same way that we treat the most important things in our lives that we bring here. That's the type of work that you're gonna receive here at Supreme Dental. So thank you so much for being here today, ladies. I know you guys love being at the podcast.
Thank you for inviting.
No problem. And next time, you know, I do a special invitation to my wife, Aida Osuna, to come down here and be added to this podcast with these ladies, and then they can have an all ladies podcast here. I'll wear a wig. We'll make it
Skincare.
work.
We can talk about skincare.
There you go. They can talk about skincare and
Korean skincare.
whatever else they talk about. So thank you so much for being here, Supreme Dental Podcast Studio, powered by Supreme Dental. And just like these ladies, keep on smiling.
And if you don't know, now you know, you know, you know.
That's right. East Coast.
And if you don't know, now you know, you know.